Okay, let's unpack this. Imagine the scene. A brand new foal, all wobbly legs and innocent eyes, just beginning its life. And then, without warning, a mysterious, soft swelling appears around its throat. It's not painful, but it's definitely growing. And suddenly, this tiny creature is struggling. Struggling to breathe, to nurse. Sounds like a real puzzle, doesn't it? That's the puzzling reality of a fascinating and, well, very specific medical condition we're diving deep into today. Equine Foal Guttural Pouch Tympany. Our mission to really unravel this mystery for you, what it is, why it happens, how veterinary experts become like fruit detectives to diagnose it, and the incredibly clever ways modern science steps in to fix it. We're here to extract those surprising nuggets of knowledge that'll make you truly well informed. So let's start with the very first question that probably comes to mind. What in the world is a guttural pouch anyway, and why does a foal even have one? I mean, this sounds pretty unique.
It really is unique. Guttural pouches are these amazing paired air-filled sacs. Think of them almost like an extension or maybe an outpouching of the eustachian tubes, which, connect your middle ear to your throat. What's truly fascinating is that you'll only find these in equids, horses, donkeys, zebras, that group. Normally, they just sit there communicating with the pharynx, equalizing pressure. Pretty straightforward. Now, guttural pouch tympany, that's when air gets abnormally trapped and accumulates inside one or both of these pouches, causing them to sort of balloon out. And here's the kicker. We almost exclusively see this in foals, typically from birth up to maybe a year old. It's super rare in adults.
Huh. So it's this unique anatomical quirk in horses that can go wrong, but really only for the little guys. What's the mystery behind why it goes wrong? Is it just bad luck or something more specific?
Yeah, but what's fascinating here is that the exact cause isn't fully understood, but we believe it's linked to a congenital, meaning present from birth, or maybe a developmental defect.
Yeah.
The most accepted theory is what we call a functional flat valve mechanism. So imagine the opening of the guttural pouch into the throat. We call that the ostium. In defected foals, it acts like a one-way valve. Air can get in easily when they breathe in or swallow, but then it gets trapped inside.
Oh, so it's like a balloon that lets air in but doesn't let it out. That's a surprisingly simple mechanical problem for something that sounds so serious. What exactly causes that one-way valve effect, then?
Precisely. It can be due to an abnormal flap formation, maybe a malformation of the cartilage in the eustachian tube itself, or even the wall of the throat collapsing around the opening as the foal breathes out. And, well, as more and more air gets trapped with each breath or swallow, that pouch progressively distends, it gets bigger, and it starts to compress vital structures nearby. The pharynx, which is part of their airway, the larynx, even the esophagus, where food goes down. You can see how that would quickly become a problem for a growing foal.
Absolutely. Yeah, I can picture that. So if you were a horse owner or even just observing these beautiful young animals, what are the dramatic yet often non-painful signs you'd actually see that would tell you something's not right?
Right. The most obvious sign is a large, soft, air-filled swelling right there in the throat latch region, just behind the angle of the jaw, in the parotid region. If you were to gently press on it, it would feel a bit squishy, like a gas-filled balloon, and it would bounce back when you release the pressure. You might even hear a soft, bubbly, kind of crackling sound, what vets call crepitation, like crinkling plastic wrap maybe when you palpate it. While it usually affects just one side, causing an asymmetrical bulge, it can sometimes happen on both sides.
Yeah.
And that creates a really large symmetrical swelling under the chin.
I can only imagine how worrying that would be to see. And you mentioned it compresses the airway. So what does that look like for their breathing? Is it constant struggling or more subtle?
It varies, yeah, but it's certainly concerning. Foals will often have difficulty breathing in what we call inspiratory dyspnea. This can be as mild as a soft snoring sound, we call it stertor, or as severe as real respiratory distress, where you'd see strenuous breathing, their nostrils flaring, and sometimes they'll hold their head sort of outstretched, trying to open up the airway.
Wow. Okay. Beyond just breathing, you mentioned it impacts their ability to thrive. How does it affect their ability to eat, which is obviously crucial for a foal?
That's where it becomes critically problematic, yeah.
Yeah.
They develop dysphagia, which is difficulty swallowing. I mean, imagine trying to nurse with something pressing on your throat. Foals will struggle to feed effectively, leading to prolonged attempts at nursing, and often you'll see milk coming out of their nostrils that's called nasal reflux.
Oh, dear.
Yeah, and they might also cough during or after nursing.
Yeah.
This ultimately leads to them just not getting enough milk, so they lose weight, they fail to thrive, they just don't grow as they should.
Wow, that's a cascading problem then. And I assume if milk is going into their nostrils, there are more serious complications that can arise from that, right? Like infection.
It's exactly. Less commonly, but very seriously. they can develop aspiration pneumonia. That's a lung infection caused by inhaling milk. Or even a secondary bacterial infection of the pouch itself, which we call guttural pouch empyema, pus in the pouch. In very rare cases, the extreme pressure can even cause neurological signs. Now, when vets are trying to figure this out, they're thinking about other swellings too, like a different kind of guttural pouch infection, which is usually painful, or maybe an abscess back there. But the key distinguishing factor for tympany is that non-painful, air-filled characteristic. The other conditions usually involve pain, maybe a fever, and often pus.
Right, so it's a bit of a veterinary detective story to figure out exactly what's going on. How do experts actually confirm it's guttural pouch tympany and not one of those other, maybe more common issues? What are their tools?
You're right. It's quite a process. First, of course, is that hands-on physical examination we talked about, feeling that characteristic soft, air-filled swelling, getting your hands on it. But the gold standard for definitive diagnosis is something called an endoscopic examination, or nasopharyngoscopy.
Okay, that sounds like a big word. Nasopharyngoscopy. What does that actually involve?
Essentially, we pass a tiny flexible camera, an endoscope, through the foal's nostril and into the back of its throat, the nasopharynx. This lets us directly visualize the distended wall of the affected guttural pouch bulging right into the pharynx, often compressing the airway right there.
Oh, okay.
We can also see that problematic opening, the ostium, and observe if there's any milk reflux happening. It's also incredibly useful because sometimes just inserting the endoscope into the affected guttural pouch can temporarily deflate it, which helps us figure out if one or both pouches are involved.
That's incredibly clever. So the diagnostic tool itself can also give a momentary clue about the underlying mechanics, like popping the balloon a bit.
Exactly.
What other tools do vets use to confirm? X-rays, maybe?
Yes, we also use radiography, or X-rays. A lateral view, a side view, of the skull and throat will show the affected guttural pouch as a large, dark, air-filled structure. Radiolucent is the term. And it clearly displaces the surrounding tissues. This confirms the air accumulation and shows us just how big it's gotten, the extent of the distension. We'd also typically do a chest X-ray to check for that aspiration pneumonia we mentioned.
Makes sense.
And finally, a quick and simple way to confirm the air is percutaneous aspiration. We just insert a sterile needle into the swelling, and if it's tympany, you'll hear a distinct hiss of air escaping.
A hiss.
Yes. Now, while it can provide temporary relief in an emergency, it's definitely not a long-term solution because the air just reaccumulates, sometimes very quickly. And there's always a small risk of infection with needles.
Okay, so once this whole detective story concludes with a definitive diagnosis, what does this all mean for treatment? Is it a quick fix, or is it a more involved journey for these vulnerable foals?
It's definitely more of a journey, and the treatment is primarily surgical. While medical management plays a crucial supportive role, it's generally not a definitive solution on its own for significant cases. We rarely see these resolve without intervention. Temporary fixes like the aspiration we just mentioned, or maybe putting in an indwelling catheter to keep draining air, can provide brief emergency relief, but they have limitations. The air comes back quickly, the catheters can get dislodged or blocked, and there's always that risk of infection.
Right. So the temporary fixes really just buy time. What's the core of that supportive medical management you mentioned? Because it sounds like nursing these foals is a big part of it, keeping them going.
It truly is. Supportive nursing is critical. We focus on frequent, small feedings of milk, often with a bottle or, for severe cases, sometimes even a nasogastric tube. We encourage keeping their head elevated during feeding to try and minimize that nasal reflux, the milk coming out the nose.
Gravity helps.
Exactly. And we are constantly monitoring them for signs of aspiration pneumonia. Antibiotics are only given if we suspect or confirm a secondary infection has set in.
Okay. Here's where it gets really interesting for me. The definitive solutions that actually fix the problem. I imagine this involves some very delicate surgery on a tiny foal.
It does, yeah. The surgery aims to create a permanent pathway for that trapped air to escape. For foals with unilateral guttural pouch tympany, meaning it's only on one side, the preferred technique is called medial fenestration. And this is where the cleverness really comes in.
Okay, medial fenestration. What's so clever about it?
Well, we create a surgical opening, a window or fenestration, in the median septum. That's the membrane that separates the two guttural pouches, left and right. This allows the trapped air from the affected pouch to simply flow into the normal, unaffected pouch. From there, it can escape normally into the pharynx through the healthy opening, the healthy ostium on the good side. It's minimally invasive, often done endoscopically with laser now, and it has a really high success rate with very few complications and a good cosmetic outcome. It's elegant because it uses the foal's own normal anatomy to solve the problem.
That is brilliant, essentially using the healthy side to drain the unhealthy one, like a natural overflow valve. Are there any situations where that elegant solution doesn't work, or what if it's on both sides? Bilateral tympany?
Right. For bilateral cases where both pouches are affected, medial fenestration can still be an option, creating that connection. However, sometimes we have to consider a more invasive procedure called bilateral resection of the stylohyoid bone, or partial osteectomy. This involves surgically removing a small piece of bone near the guttural pouch, opening to permanently widen the passage into the pharynx for both sides.
Okay, so a bit more involved.
Yes, definitely more involved. While it provides direct drainage, it's more invasive and carries a higher risk of nerve damage, like facial nerve paralysis, or potential for persistent difficulty swallowing afterwards. Post-surgically, regardless of the method, we focus on prophylactic antibiotics to prevent infection, pain control, usually with NSAIDs, monitoring closely for any complications, and of course, continued supportive nursing until they're fully recovered and feeding well.
Right, the aftercare is key.
Absolutely. Now, if we connect this to the bigger picture, what's the long-term outlook for these foals once they've undergone treatment? And, what does this condition tell us about prevention, if anything? Well, the prognosis is generally excellent with surgical intervention, especially with that medial fenestration technique. The vast majority of foals respond incredibly well. They go on to live completely normal lives, often achieving their full athletic potential. No reason they can't be racehorses or performance horses.
That's fantastic news for owners, so they can truly thrive after this. That must be a huge relief. But you mentioned a recurrence rate for some cases earlier. Is that common?
Yes, they absolutely can thrive. The recurrence rate is something we are aware of. It's been reported around 30% in some studies. It often comes down to the persistence of the underlying anatomical issue, that faulty valve maybe not being fully addressed, or sometimes the initial surgical opening might partially close over time and need revision. Prognosis is definitely more guarded if severe complications like aspiration pneumonia, chronic swallowing difficulties, or that secondary infection empyema have already set in before treatment. Early intervention is key.
Right.
And untreated severe cases can unfortunately lead to chronic poor growth, life-threatening pneumonia, and potentially even death. So doing nothing isn't really an option for significant cases. As for prevention, since it's likely a congenital defect, there's no specific way to prevent the primary problem itself from developing in the first place. While we haven't identified a specific genetic marker, there is some anecdotal evidence of familial tendencies. You might see it pop up more in certain families.
Interesting.
So if a strong genetic link is confirmed down the line, responsible breeding practices might be something breeders would consider. But what truly stands out in terms of managing this condition and ensuring the best outcome is the absolute criticality of early recognition and diagnosis. Catch it early, get the right surgery, and you're looking at a really good chance for a normal, healthy life. Miss it or delay, and the cascading effects can be devastating.
So what does this all mean for us? We've journeyed from a curious, kind of alarming swelling in a young horse's throat to understanding a surprisingly simple, yet profound anatomical defect, this one-way valve issue, and then learning about the ingenious surgical solutions that can completely transform a foal's future. It's truly a testament to how specialized veterinary science has become.
Indeed. It really is. Consider the incredible precision of modern veterinary surgery, especially endoscopic techniques now, allowing these tiny, vulnerable foals not just to survive, but to truly thrive and potentially reach their full athletic potential. All by fixing what amounts to a small, crucial one-way valve in their heads. It truly makes you appreciate the delicate balance of biology and the ingenuity of intervention. This condition reminds us that even seemingly small anatomical quirks can have profound impacts, and our ability to intervene so effectively is a real testament to dedicated research and surgical skill.
A fantastic point to end on. Thank you for joining us on this deep dive. Keep that curiosity burning.